July, the State Bar formed a senior lawyers working group to address the aging of the attorney population in California. A 2011 survey showed that at that time that over 43% of attorneys in California were over 60. The current trend among professionals by choice or necessity these days is to delay retirement. This gave rise to the question among the members of this group as to whether all members of the bar ought to be tested at a certain age to see if they were still competent. I don't think that idea went over too well. I noted last night in researching some statistics that there's still 31 lawyers, members of the bar, who are at least 100 years old. So Dr. Jonathan Canick has practiced psychology and neuropsychology for 30 years. He's a member of the departments of psychiatry and neurology at California Pacific Medical Center and is an assistant clinical professor at UC San Francisco. He provides continuing education to attorneys on a variety of topics, including aging and cognition, elder abuse, undue influence, and evaluating cognitive capacity. He's presented at the Commonwealth Club, the American Bar Association, the California State Bar Convention, the San Francisco and other Bay Area bar associations. His practice includes neuropsychological assessment, capacity, forensic evaluations, assessing disabled professionals in early identification and treatment of dementia, particularly in high-functioning individuals. And as you'll learn, this is an especially difficult task. So welcome, Dr. Canick.
Well, thank you very much for inviting me to speak to you this afternoon. I hope you will find this talk interesting, but also personally relevant, because this talk is about you. It's about us, that 3% of the population that is so blessed that we get to make a living using higher order cognitive and sensory motor capacities. The issues that we're talking about here today are unprecedented. Never before have there been so many of us professionals aging in place. People in their 80s represent the fastest growing segment of our society. We are on virgin territory. One message that I do hope you come away with today, though, is that normal aging does not result in a loss of professional competence. In fact, significant cognitive decline is not a normal part of aging. If it is occurring, please get attention. Save your or somebody else's brain. If left unchecked, significant cognitive problems can result in disorder, disability, a loss of professional competence, and much worse. Healthy aging does not result in significant cognitive decline. But don't take my word for it. Let's consult the Supreme Court. Now, many of you might not recognize this individual, but in 1830, Henry Baldwin was nominated to the Supreme Court. Within 2 years, Daniel Webster was decrying the outbreak of Baldwin's insanity. The following year, he missed the 1833 term because he was hospitalized with incurable lunacy. He remained 11 years on the bench, all the same. Now, this most austere and dignified gentleman needs no introduction, because at age 90 and 309 days, Justice Oliver Wendell Holmes finally retired from the bench. Incredibly successful Supreme Court justice, prolific, productive. And so you see, you could be 50 and incompetent, or you could be 90 and at the epitome of competence. The Supreme Court offers us more examples, because at age 94, Justice John Paul Stevens, while retired, gives commanding and impressive testimony to Congress. And at age 84, RBG is the lioness and maverick of the bench. Part of my role at California Pacific Medical Center is to train physicians and residents in how to identify cognitively impaired patients, because there's awareness and acceptance that physicians are actually not trained to do this. And at the beginning of their rotation with me, I have them draw a line depicting the relationship between cognition and aging as you go from 25 to 85. These three examples over here are what about 95% of them draw. Now, this is astonishing given the fact that there was a revolution in our understanding about aging that hit about 15 to 20 years ago. It has not trickled down. These folks believe that aging is a neurodegenerative disease and disorder. There's no question about significant decline. It's just a matter of the magnitude of it. We are like totally screwed in their eyes. Some of them, I guess it's like a reverse rocket. It's about stages of decline and deterioration. But decline and deterioration is what their sense of normal aging is. Some of them draw ones like this, where you're sort of going along. I don't know if you die or you fall off the shelf. Least common, in maybe 2% of the cases, is this line. That's the one that's closest to the truth. Now keep an eye on the slope of those lines, because what you'll see is what most physicians think of as normal aging is actually the process of dementia. They have confused aging with a neurodegenerative disease. It is not. Dementia is. And if you think that aging is a neurodegenerative disease and that dementia is normal, and they normalize serious cognitive impairment. So that when you go to your physician and say, I think my ability to concentrate and remember is not as good as it used to be, how are they going to respond? What do you expect? You're getting older. Or as Gabby mentioned at a previous talk, talking to a physician about some concerns about memory impairment. And the physician responded, it sounds like you've got CRS. Can't remember. I find that there's some physicians who say that, but they're suffering DKS. Don't know. That's where they get the idea about aging and the brain and cognition. That's the line that they were drawing, and that is the picture of vital organ capacity as you go past the age of 25. It's not a very pretty picture, but that is what physical aging often entails and involves. Now, in contrast to the slope of that line, let me show you what the slope of the lines related to aging as relates to cognitive functions across the lifespan. That's a very different slope, in fact. We could divide cognitive and intellectual functioning into two broad classes, what we call fluid and crystallized knowledge abilities. Fluid abilities, real-time processing, requires fast processing, learning new problems, solving new problems. Crystallized knowledge, as we'll soon see, relates to the contents of knowledge. This table and graph shows fluid abilities that are more susceptible to the effects of aging. And as you can see, in contrast to what most of these physicians and residents think, there's a bunch of abilities that actually improve as you're getting older. There's no physical functions like that. And something like your vocabulary is stable throughout the lifespan. You have 100% at least of the vocabulary you had when you're 25, when you're 85. There are some changes. Our reaction time changes. It's a little bit harder to make new memories, to have them stored into old memory. But we're talking about being 70 to 85 and having anywhere from 70 to 100% of the abilities you had when you're 25. There are no physical functions that are like that. These are the more fluid cognitive abilities susceptible to change. Because if we entertain crystallized cognitive functions and IQ, like your verbal IQ, that's the picture across the lifespan. And it is incredibly stable. In fact, we know that you are suffering some kind of dementia or serious disorder if your IQ doesn't stay the same. That's normal aging. If we put those two pictures together, it's like this. Again, crystallized knowledge and intelligence, very stable. We see some changes in those fluid abilities that are very dependent on quick processing speed, reaction time, and so forth. So there are some changes that occur. Like I said, processing speed declines, and that can affect our attention. That's why, as we get older, it's harder to divide our attention, to multitask, because we're not processing information as quickly as before. Our working memory, the ability to hold information in our head and just have it stay there, that goes through some changes. We get into our 50s and 60s, and we start having the experience of, what did I come in this room for? I know there's something. And where did I put that paper? And that starts happening. Sometimes people come to see me in their 70s or 80s because they fear they have a dementia, because they notice that their reading comprehension, or so they think, has declined, and they're really quite fearful. Well, again, oftentimes it's actually something more benign that's associated with a change in processing speed. You see, our eyeballs, they're very used to us. They've been in our head our entire life. So they get very conditioned to moving at a certain speed. When the brain no longer computes that information as quickly, it doesn't grasp it and comprehend it as quickly, and people falsely conclude, uh-oh, I'm losing my mind. Well, no, it's about your processing speed. The ability to rapidly acquire information, to rapidly retrieve it, that goes through some changes too as we age. But we're talking about a change in facility, not about a loss of faculty. And then there's wisdom. You can't have wisdom unless you're older. It is knowledge and experience blended together that enables us to imagine things that are unseen, to see around corners, to anticipate possibilities that have yet not even come into existence. Many of us have already made the mistakes and learned from them that our younger counterparts have not even imagined. It puts us at a tremendous advantage. There is a reason why people make better decisions as they get older. We make more nuanced, sophisticated decisions. The older brain literally recruits more areas of the brain than the young, impulsive brain does. We are at a distinct advantage over such folks. Robert Hutchins, the former president of the University of Chicago, was a big advocate of adult lifelong learning. And one of his famous sayings was that most of the important things that a human being ought to know cannot even be comprehended in youth. And it is true. So one thing we can be sure of when we're talking about professional competence, we're talking about concerns that relate to function and capacity, not age. We are so biased and ageist and so contaminated by ageism that we don't realize we have confused the process of aging with the cumulative effects of harmful, if not deleterious, habits. And so yes, if you drink heavily, if you abuse drugs and substances or medications, if you have poor diet, if you don't get good cardiovascular exercise, if you have poor sleep, lots of stress, do not have meaningful social or fulfilling outlets, and you do not take care of your hypertension or your diabetes, you are going to decline and deteriorate. But that's the cumulative effect of those conditions, not aging. The issues that we're dealing about, unprecedented. Again, there's never been so many of us living this long, aging in place. The problem of modernity. In the good old days, well, people didn't live that long. We know that there's an increased incidence of dementia in the 80s and 90s. Not dramatic, but it increases. In the good old days, people were dead by 70. We didn't have this incidence of dementia. Not necessarily a preferable thing. People retired if they didn't die. And most of the people who were professionals were white men. Things have changed. We're living longer. Our environment is healthier. We have vaccines, medicine, the water supply, the food supply is better. From 1900 to 2009, we've just about doubled our life expectancy. The person who will live to be 120 has already been born. We are living longer. We're not only living longer, but there's more of us. From 1900 to the present time, our population has increased by 400%. The U.S. has the fastest growth rate of industrialized countries when you consider both immigration and our fertility rate. We're living longer, there's more of us, and we're getting more educated. From 1940 to 2009, there was a 5-fold increase in people with bachelor's degrees. Almost 90% of us have a high school education, almost a third have a college degree, and 3% are professionals. 1 in every 300 Americans is a lawyer. I'll leave the punchline to you. From 1910 to 2000, there was a 500% increase in the amount of professionals. So yes, we are on virgin territory. We have never faced these circumstances before, and it is going to increase. So these issues that we discussed today are really quite relevant and important. Capacity and competence are terms that span both your and my field. I use capacity to denote those functions and abilities that underlie a specific competency. Competency denotes a certain threshold, a certain level of mastery. Our professional associations specify what defines a competent person. You have to pass the bar, you have to take continuing ed like you're doing today. Capacity are the different functions that might underlie a given competency. Capacity is not a one-size-fits-all. There's different capacities, different cognitive and sensory motor abilities are needed for different capacities. To decide in the hospital that you don't want to be resuscitated is actually a binary decision, yes or no. To make an informed medical decision requires a little bit more ability. To make a will, to be a testator, some more still. And then are we talking about a $20,000 estate or a $200 million estate? Because there are differences in what would be required to do a competent job. And so it is with the work and professions. To be a lawyer, a physician, a judge requires a level of competence and amount of capacities that are beyond that of a bricklayer. And then even within the field, there's degrees. Are we talking about a traffic court judge or a Supreme Court judge? Because there are different levels of competence and capacity needed with each of those, even if we sometimes think not. So when I get asked, do they have capacity, the answer is always the same. To do what? Because the answer to a question of capacity lies with the activity in question. Capacity is not an abstraction. It is always tagged and connected to some activity or some threshold that we're looking to determine if there is sufficient amount of ability. Now, the greater the demand and cognitive demand needed, the greater the chance that that capacity will be affected by illness, disease, medications, dementia, and so forth. So if you need a higher level to do your job, to some degree you can be more readily taken out. I had a case of an SEC attorney who needed to function at the 99th percentile, 98th percentile to do his brilliant, very superior work. We don't generally see very superior ability. We appreciate it when we see somebody at work doing things, but to interact with each other, it's not like we grossly see that. And he had injured his back, required surgery that did not work out, and he needed to be on pain meds to manage intractable pain. That eliminated his occupation. Just like a very renowned research scientist who developed Parkinson's lost his ability to do his work at the high end, whereas another case that I could think of a plumber who was genius, brilliant man, who got into a car accident and acquired a traumatic brain injury, but he still could do his plumbing. So again, the more that you need high-end abilities, the more that they can be affected by different things. And that is something that I'm involved in assessing, because I can measure and determine if you've dropped down from the 99th to the 90th percentile. And there's no other metric that can capture that. There's no brain scan, there's no lab that can do that. So if we look at a hierarchy of cognitive capacities, of which there are, as you go and ascend the vocational ladder, well, to show up at work, well, you got to be attentive, you got to be vigilant. If you're a bricklayer or chambermaid, you got to have psychomotor abilities, do things with your hands. You got to be able to remember a certain amount of information. But as you ascend that ladder, you need increasing amounts of cognitive abilities. If you are manipulating those notational symbols referred to as numbers because you deal with data or financial analyses, you've got to have symbolic reasoning abilities. You need to have executive functions in order to understand how this leads to this, leads to this. That's called sequential reasoning. And if you can't do that, you can't fathom consequence. And again, if we're talking about planning for conditions and circumstances that don't even exist, we're talking about abstract capacities. If you're planning for the future, we talk about these terms so blithely, but there's nobody in this room that can point to where the future is. It's an abstraction. And then, if you're a professional, you need executive functions to be aware of yourself while you're engaged in the task, so that you can note and correct errors that you might make. In the hospital setting, if I'm looking to evaluate a very basic fundamental level of capacity to make a medical decision, to decide about DNR and things like that, I'm really looking at this low end here. I'm looking to see that people are not in that range. That's the range in which people are grossly and overtly symptomatic. That's like the 3rd percentile and below. That's where frankly demented, institutionalized people, how they score on different tests of cognitive ability. When I'm entertaining questions about professional competence, I'm looking to see capacities in this above average to superior range. That's the range we would expect professionals to function at, and virtually everyone in this room is functioning at that level, or you would not be able to do your job. Measurement. Measurement is the cornerstone of science. It's what took us out of the dark ages of superstition and subjective bias. It enabled us to objectively know things, to measure them so that we can verify them, make them reliable, and validate them. Again, I measure the capacities that underlie different competencies. When you're asking, is a person functioning to a certain expected level, or has something happened and they're no longer at that level, you are asking a normative question. My field brings forth normative data. when I test you, I end up comparing you, to someone your age, your sex, your level of education, sometimes your ethnic background, so that I can make a comparison with what we would expect you to be at. That's normative data, and it is a very powerful tool that can identify things that could never be identified on any other lab or scan. And so there is a strong relationship between IQ and vocation. Most vocations do not require a lot of intelligence. And the higher the intelligence, the fewer there are vocations that are like that. It's not too different than a sports analogy. Hopefully everyone in this room keeps physically active and exercises. You might enjoy different sports, but you're probably not professional athletes because you're not part of that small fraction of 1% that fits that bill. And so it is when it comes to professional functioning too. There's a small percentage who have those kind of intellectual and cognitive abilities necessary to complete those tasks. The Wonderlic is a test that has been around for decades and studied with many different populations. And it's one of the measures I use because it includes normative data that has been studied from people who are janitors and working at a warehouse to attorneys at the other end of the spectrum. And we have a range, and we know what the expected range is, which is very helpful to then determine if somebody has fallen out of that range, and then why. What is that about? There's a correlation between cognitive ability and job potential. The Wonderlic measures general cognitive ability, strongly correlated with IQ, but also vocational status. So at the low end, you need to be explicitly taught what to do. You need to work on this piece of simple equipment over and over again until you master it. At the other end, you're able to make inferences, conclusions, based on information that's not even in front of you. So a very different level of cognitive ability that's associated with that and needed in order to do that. It's just the nature of reality. Here's some other different occupations, again, showing with Wonderlic scores to give you an idea. Some of you may be familiar with this. We probably have some NFL fans here. The NFL makes wide use of the Wonderlic, especially with quarterbacks, but increasingly with other people too. Colin Kaepernick, he scores at the 99th percentile of the population on this test of general cognitive ability. Andrew Luck scores like at the 99.9th percentile. These are like genius, brilliant people, even if they're getting knocked around a whole bunch. That's the range we would expect you all to function in. That's the range that attorneys would be expected to function in. This above average to very superior range, and depending on your niche, again, it might be higher or a little bit lower. That red bar denotes the sort of minimum cutoff to sort of assure that there's going to be success. By the time people are grossly symptomatic, there's been so much brain change that the brain no longer is able to regulate itself. That's why they're grossly symptomatic. If you see somebody who's symptomatic where you can see it with your naked eye, tremendous decline has occurred. Now, quite honestly, and most sadly, I would have to tell you that that's the point at which most people get attention or get identified by their doctor as, I think we've got a problem. And it's very unfortunate because people have long lost their professional competence by that time. Virtually every bit of malpractice that occurs, it's actually a clinical event. And as such, it could be articulated and identified earlier in its course, and it could be avoided if we take this kind of approach. Every year, several times, the following scenario happens. You all know what a hospitalist is, a physician who works just in a hospital setting. And I cover the hospitals with questions of capacity. And the hospitalist says, Canick, got somebody upstairs, can you take a look at him? He's fine, I've been dealing with him, he's good. In fact, you'll recognize him. He's a former San Francisco politician. We're getting ready to discharge him. Nursing staff's a little bit concerned about how he's doing. He's fine. I've been dealing with him. Could you just go up there, give a quick look, and so we could discharge him? Sure. That's what I do. So I'm in the patient's room when the hospitalist herself comes in. And I turn to the patient and I go, now, you remember me? Yes, of course. You remember the conversation we were having? Yes, I do. Have you been thinking about those things I asked you to think about? Yes, I have. Can you share with us your thoughts? Upon which he does. The hospitalist turns to me and says, just as I thought, everything is fine. Except I turn back to her and I go, this is the very first time I've ever spoken to this man. Everything he's saying is made up, a confabulation. And furthermore, he's a former politician. He's accustomed to covering up his incompetence. And so it goes. The more intelligent you are, the more conversational, social skills you have, that helps to elude and obscure the problem, which is unfortunate because sometimes that people don't get detected. Now, very sadly, I would have to also tell you that the higher functioning you are, the more you're going to be dismissed by your physician. Because they're going to say, you sound fine to me. I have to be a driveling idiot in order for you to know that there's something wrong? Because again, sometimes it's something so simple. A B12 deficiency. A folic acid deficiency that, again, might be treated early on with a bowl of lettuce. But it doesn't get picked up on. So you develop permanent brain damage that you're not going to come back from. Happens every day. People, most common diagnosis, some very high-functioning person who knows that there's something wrong with them, the most common diagnosis they have prior to coming to see me is, there's nothing wrong with you. A level of remarkable arrogance. There's a longer time before high-functioning people get identified because they're coming from up on top. The more educated you are, the more developed your brain is, the more you have what we call cortical reserves. Nothing creates and develops cortical reserves like education. You go to high school, you go to college. College develops your brain. You go to law school develops a developed brain all the more further. And that actually acts as to buffer the effects of aging. People with more cortical reserves come out of brain injuries, strokes better, and so forth. And if you're going to express dementia, it's going to be a lot later than somebody younger who has less cortical reserves. And so, as I've been mentioning, sadly, very high-functioning people have to decline and deteriorate till they're grossly symptomatic before people detect it. But that's not what I do. Because the change from very superior to above average is no different than the change from average to seriously and significantly impaired. I don't have to wait till you're not know who you are or know who your kids are to know that there's a problem that we might be able to intervene with and alter the trajectory of the outcome. Or maybe you are a professional who's had a stroke, but you know what? You've got all kinds of ability, even though you've lost the ability to talk. Your thinking is still all there. That could be determined and known. But generally, it doesn't happen. And then those mental giants that top 1 to 2% of the population. Just as we have everyone in this room is high functioning, you could not have made it into this room, there's some mental giants here too. Do you care to raise your hand to identify yourself? When mental giants decline, it's unlike anything else. There are these residual islands of ability. Land on the island and you'll think everything is fine. fall in the water, you'll know something different. I have a patient of mine who's a rocket scientist, the real deal, brilliant genius of a man. He doesn't know who his kids are. And if you showed up, he would easily believe you're a relative. But if you sit down to a game of chess, you're going to lose. And so the case was with Henry. He was one of these gifted geniuses, and he's alive. He's not a genius anymore. Henry went to Ivy League school, Ivy League medical school, top-notch residency. He comes out, he's a physician, he is top-notch. But as will occur with brilliant, genius people, it's not necessarily a blessing, there's a curse. Such people get bored easily. They need new things all the time. And so Henry kind of got bored with medicine. He picked up business skills. He decided to get an MBA so he could manage his own investments and his pension. He was so successful and effective that his colleagues and friends asked him to manage theirs as well, which he did. But then he got bored again. And at this time when this new field of biotechnology was emerging, he got on a bandwagon and became a CEO of a biotech company to boot. Henry did it right. So by age 65, he had millions in the bank and looking at a great retirement. Except his family started noticing some changes. And of course, he didn't have any awareness to this day. See, Henry was suffering from a corticobasilar syndrome. And it's known by two qualities. The first quality is you lose self-awareness. And when you lose self-awareness, you lose awareness that there's a problem. And the second problem that really develops is what we call dyscalculia. You lose the ability to do mental arithmetic. And while Henry shows some residual islands of ability here, there's all these other results down to the below the first percentile. His performance there is on a test of mental arithmetic. Henry, you're still managing those investments? Oh, yeah, no problem. I don't think so. And I forced the issue, and we had accountants come in who discovered, don't know where the millions have gone, but they're no longer around. All we know is that at this point, Henry's got $250,000 in the bank and a house with a hefty mortgage. So let's say you're high functioning, you're a politician, and you're an actor. 1984. I'm watching the presidential debates with some colleagues. We're all training in neuropsychology. And Reagan gets asked a question, and he responds, Nancy and I, we were driving down Highway 1, and he was a deer in the headlights. He was lost. He did not know where he was. And I point out to my colleagues, our president is dementing. That's a very serious sign there. Ron Reagan, the son, if you've read the book My Father at 100, makes mention of that event and talks about how heartbreaking it was because they realized that Dad's Alzheimer's disease was really pronounced. This was the end of the first term. The second term was characterized by some real scandals. There was a war going on against the Sandinistas that nobody knew who authorized it. Ollie North and Fawn Hall did it on their own. There was arms going to Iran to exchange for hostages. Reagan had to get on the television and say, I have no memory of doing this, but I'm looking at the data, and while I know in my heart I didn't do it, my mind tells me I obviously did. Plausible deniability was the term of that second administration. And there's nothing like Alzheimer's to give you a plausible deniability. I'm a doctor. I'm not just a tester and human resource person. I'm interested in knowing what's driving the change. What difference do we make? How do we salvage things? Maybe we can't. Maybe it's about someone who is dementing, who's a professional. We are so blessed. We get to use our minds. And when we lose that, we lose ourselves. And we deserve the respect, the dignity, the attention, the care to help deal with and cope with that. There's maybe ways to treat it, maybe ways to compensate, to make adjustments, and so forth. And I seek to make those things happen. Miss B was 68 when she came to see me. She was one of the younger children of a very large immigrant family that did not place much emphasis on their daughter's education and certainly not their vocational attainment. So she went to junior college where she got straight A's. She completed her education at a state college where she also got straight A's. And she was working as a bookkeeper when she got hired by this new business called High Technology, before it was called High Tech. And within years, she was director of finance because she was an incredibly gifted individual. She was so successful, she decided to pursue her lifelong dream of becoming a lawyer. And she went to a very fine law school, passed the bar right away, and was working very high-end transactional kinds of legal work. And she started noticing that her memory was not working like it used to be. And it eroded her sense of confidence, as those things will. And she decided that she's going to resign and retire because she's obviously gotten too old to do her work. I am continually amazed and alarmed by how people who are suffering some disorder, some disease, some disability, elect to retire because they're so victimized by their ageist notions that they believe that it's about aging. So she came in and we did an evaluation, and these were the results of the evaluation. And as you can see, most of the results, her IQ is all at the 98th, 99th percentile, way up there. She's a gifted individual, but there are these other findings that do, just as she accurately reported, the higher functioning you are, almost always your self-report is accurate. Very bright people pick up on things quickly. It's part of what makes them very bright. And they pick up on changes in themselves too. So she was right. And I remembered her telling me that she's often tired, and I made more inquiries to find that she's got a raging sleep disorder. She's always tired. She's using her lunch hour to take a nap during the lunch hour. She had some disturbing family things that were keeping her up at night. There was some alcohol use, but we addressed it in treatment, addressed some of these family relations that were problematic. She stopped the drinking. She started practicing really good sleep hygiene. Sleep is essential brain food. If you don't get enough sleep, you will become symptomatic. And 6 months later, everything was restored. And she went back to work. I'm not going to quit. I love my work. And now she's able to do it, and so she continues. Miss C was also an attorney who was a bit younger at 61. She had a family history of Alzheimer's disease, and her physician knew that. And she reported to her physician, my memory's not so good. I'm noticing some changes. And reported it again the following year and the year thereafter. And the physician said, obviously you got Alzheimer's. It runs in your family. This is obviously what's going on. And Miss C asked her physician, I enjoy my wine. Might I continue drinking that? And the physician essentially said, well, you're kind of headed for oblivion. You might as well enjoy the wine. So she came to see me to get a second opinion. And these were some of the results of her testing. This is contrary to the presence of dementia. This made clear that there was no dementia. Her abilities, her intellect, was highly developed and intact. There was some changes in, again, fluid intelligence that's involved in the application of her knowledge and ability, but the contents of her knowledge was all there. Other measures that I use to denote whether somebody is suffering a change in intelligence and intellectual functioning made clear that no such change was going on. Her performance on memory testing was symptomatic, but unlike Alzheimer's, where you see a pairing of verbal and visual memory impairment, there was a significant divide between her verbal and visual memory. Furthermore, Alzheimer's is characterized, one of the fingerprints of it is what we call an amnestic disorder. You progressively forget what you had learned. Miss C was evidencing just the opposite pattern. And when I gave her a test that's associated with dementia, while she again scored symptomatic, she didn't score in the range suggesting a dementia. And I sat Miss C down. And I said, one thing I could assure you of, you do not have Alzheimer's. But you know what? I think you're drinking a lot more than you told your physician. To which she acknowledged that she'd been drinking a bottle of wine a night for years. You are acquiring alcohol-related brain damage. If you continue drinking, like your physician said would be okay, you're going to lose your mind completely. But if you stop, I think you're going to recover every single ability that has changed. And that's what's begun. Now, negligence is a term that you all could define far better than me. I mean it to describe there's something you know, there's something you see, there's something you hear that you don't want to know, see, or hear. And that's apropos the case of Mr. L, a 71-year-old, high-functioning individual, internationally renowned, firms in multiple countries. He had a family history of dementia, like a who's who of different dementias. It was remarkable. Everyone in the family was dementing. He had been seen at a memory clinic for 6 years, except nobody was cluing his wife in to how he was doing. And she came to see me because she was terrified. He was increasingly aggressive, violent, abusive, disinhibited, all these kind of qualities. And she was wondering about what's up and what's going on with him. And he came in to be evaluated, and when I came in to meet him into the testing room, he greeted me with the one-finger salute and a suggestion of something I should go do to myself. Now, I grew up in New York, and that's sort of the way we say hello to each other. So it didn't bother me, but I knew that Mr. L was one disinhibited guy. And these were some of the results of testing. This gifted man who typically scored beyond the 99% of the population was scoring below 99% of the population. When asked to name shopping items, he could only come up with 4 items in 60 seconds. He could not define what a thermometer was. He could not name a picture of a bed until he was given multiple choice answers. And he could not begin to fathom any way in which a boat and an automobile might be alike. Other tests of dementia showed him he was scoring just like frankly demented institutionalized people score. So he is very advanced dementia, and yet he's the head of the firm. Woody Allen tells the joke that he attributes to Groucho Marx. The guy that goes to see the shrink and tells the shrink, I'm here about my brother. Okay, my brother. What is it? My brother thinks he's a chicken. Thinks he's a chicken? What do you mean? He thinks he's a chicken. Bark, 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 the whole 9 yards. How long has this been going on? It's been going on about 10 years. 10 years? Why have you waited so long? I needed the eggs. I contacted Mr. L's firm. They're telling me, oh yeah, no, he's the head of the firm, and he's the person who signed on all kinds of loans. In fact, we're getting ready for him to sign on a new $2 million loan. I said, no, you're not. He doesn't have competence to do that. He lacks financial, donative, contractual capacity. But there's got to be major calamity going on at work. Don't tell me that this crazed, disinhibited guy is doing just fine at work. Well, we've had major problems. There's about 6 restaurants that have barred him. He causes scenes in the office. And on occasion, he will defecate in his pants and just stay there the whole day. That's a lot of defecation to put up with. And if we approach him about that, he will get violent. They needed the eggs. They feared that they would lose the figurehead, they would lose the, the referrals and all this kind of thing. Remarkable, remarkable folly. Thank you very much.